Let's continue with diagnosis according to Zanko organ patterns, in particular, lung vein cold invasion. Let's look into invasion of vein cold in the lungs in excess patterns. An invasion of vein cold is an acute pattern that does not usually last for extended periods of time. The vein cold either being quickly expelled from the body or transforming into heat and penetrating deeper into the body. It is nevertheless important to diagnose and treat this condition correctly. Furthermore, it is important to remember that it is the symptoms that define a pattern of imbalance. If a person manifests with symptoms of vein cold, then there is vein cold. This is relevant, for example, in the diagnosis of hay fever and other allergic reactions. Etiology. There will be a powerful heat chi that has been potent enough to pierce the body's weight chi. The invasion can arise if the person has been exposed to climatic wind or cold, but it can also arise after exposure to artificial air conditioning. Furthermore, some allergens and pollutants can also provoke a wind-cold pattern of imbalance. There may be underlying wei qi deficiency, which means qi does not require the same strength to be able to penetrate the body's defenses. Its symptoms and signs: there will be acute headache, stiffness in the neck and upper back. There will be joint pain, skin and muscle aches, aversion to cold and wind, lack of sweating in an excess condition, and perspiration that does not relieve the symptoms when there is wei qi deficiency. There will also be possibly a slight fever. There will be coughing, sneezing, slight breathlessness, an itchy throat. The person will pack themselves into warm clothing. The person will have a stoop posture. There will be thin, white, moist coating on the tongue and a superficial and tight pulse. The key symptoms here are sore, aching muscles and joints, aversion to cold, superficial and tight pulse. The treatment principle: open the exterior, expel wind and cold, and activate wei qi. For the acupuncture points, you can choose from lung 7, Li4, gallbladder 20, bladder 10, bladder 12, bladder 62, and SI3. For the needling technique, we can use draining. We can also use vacuum cups on bladder 12 or gua sha on the upper back is recommended. As for the explanations of the points, lung 7 and Li4 regulates the lung functions of descending and spreading, activate wei qi, and expel wind and cold. GB20, bladder 10, and bladder 12 expel wind and activate wei qi. SI3 and bladder 62 expel exogenous qi from Taiyang aspect. Relevant advice: when there are invasions of vein cold, it is advisable to consume beverages that are hot and spicy to open the exterior and expel qi. This could be, for example, ginger, garlic, whiskey, brandy, or chili. Fasting is also advisable, or only eating soup such as onion soup. There are two reasons for this. First, when temporarily fasting, qi will not be used to transform food and therefore can be used to combat the invading qi. Second, some sources say that the downward movement of food and qi in the stomach can draw the exogenous qi inwards from the surface. Similarly, the sour flavor should also be avoided due to its astringent or centripetal dynamic. Vitamin C, lemon, and other things that are very sour or should not be consumed during an invasion of exogenous heat cold, as they will draw the heat cold inwards while closing the pores in the skin, thereby preventing the cold from being expelled again. This also means that antibiotics are not recommended at this stage as they are cold and drained onward. So invasion of wind cold can be caused by the following pattern of imbalance. Lung qi deficiency. Invasion of wind cold can result in the following pattern of imbalance. Wind heat, phlegm, heat in the lung, phlegm fluid in the lung heat, yang heat, and Shaoyang disorders. So to summarize, wind cold invading the lung usually is due to exposure to exterior wind and cold, a relative weakness of the body's qi in relation to pathogenic factors. It will manifest with aversion to cold, fever, cough, itchy throat, slight breathlessness, stuffed or runny nose with clear watery discharge, sneezing, occipital headache, body aches, absence of sweating, heavy voice, and itchy throat, cough, and the absence of thirst. The patient will also have a floating and tight pulse in a thin white tongue coating. For its treatment principle, we dissipate wind cold, diffuse the lung, and suppress cough. For the acupuncture treatment, we may use lung 7 as it releases the exterior and expels wind. GB20 expels wind. Do16 also expels wind. Bladder 12 expels wind and releases the exterior. Sanjo 5 expels wind and benefits the head. Li4 releases the exterior, and bladder 13 suppresses cough and regulates lung qi. We need a good drainage for headache. We add Do20 and Si3. For absence of sweating, we add kidney 7. For nasal congestion and running nose, we add lung Li20 and extra point in tongue. For cough, we add bladder 15 and bladder 11. Thank you for your attention.